but I think almost everything is just know the articular features, what they form a joint with, what's the name of the joint. Some of this is built into joints, and what type of synovial joint is it. And in the lower, there's two non-synovial joints, but I'll cover those when we get there. But in the upper extremity, everything is a synovial joint. Okay, so I'm going to start with clavicle, and you just need to know the medial end. So this is teaching, as I said before, I'm totally teaching towards the final. I'm leaving everything else out. Okay, so you could follow your notes, or you could, I'm not going to talk that fast. If you want to take notes, it's fine. If you don't, it's totally okay. Audio taping is allowed, but probably people don't do that now, so you don't worry about it if you're not going to do that. But okay, so medial end of clavicle articulates with clavicular notch of the sternum. That's called the sternoclavicular joint. So medial end of clavicle with clavicular notch of sternum, it's sternoclavicular joint, it's saddle, and test-wise, just know they're the only joints between upper extremity and axial skeleton. There's going to be something comparable, we'll get there in a few minutes, with lower extremity, but the two sternoclavicular joints are the only joints between bones of axial skeleton via the sternum and upper extremity. That's their claim to fame. And the lateral end of the clavicle articulates not just with scapula, but they always ask which feature of the scapula articulates with the clavicle, or which the clavicle articulates with which feature of the scapula, and it's the acromion process of the scapula. So know that the lateral end of the clavicle articulates with the acromion process of the scapula. That's called acromioclavicular joint, it's gliding. So the lateral end of clavicle with the acromion process of scapula, and that's acromioclavicular joint, gliding, synovial. Everything's synovial in upper extremity. That's all you need to know about clavicle. Now scapula, there's a ton of features, but I'll go through a couple of things, but I'll just do the articular features get emphasized the most. So the two articular features of the scapula are the acromion process, which is also, everything on the scapula is muscle attachment except the glenoid fossa, that's articular only. So if they say which feature of the scapula is articular only, it's the glenoid fossa. Acromion process, they're not going to ask this directly, but it is muscle attachment on one side. That's the side you can easily palpate. That's it. Don't worry about names of any muscle. That's the next course, but it is the deltoid muscle. So acromion process, like everything on the scapula, except glenoid fossa, is muscle attachment, but it's also articular with, as we just said, with the lateral end of the clavicle. So the acromion process is an articular feature that forms the acromioclavicular joint. But the other articular features probably emphasize more. The glenoid fossa is articular only and called, even though it's the lateral angle, that term isn't going to be used. Just know it as glenoid fossa or glenoid cavity. Articulates with head of humerus to form shoulder joint, ball and socket. So glenoid fossa or cavity articulates with head of humerus to form shoulder joint, ball and socket. Okay, so that's pretty much everything on the scapula. But the other question that comes up is more, because we're palpation and massage oriented, just know that the posterior features of the scapula, the ones you can palpate easily, even though hardly anyone's in palpation, you still can easily feel these, are like spine, acromion, supraspinous, infraspinous. So sometimes they say which features are on the posterior surface, spine of scapula, root of spine, but they're probably not going to use that one. Acromion process, even that's lateral, so probably won't be a choice. Supraspinous fossa, infraspinous fossa. The only two features, actually the only feature that's technically on the anterior surface, because coracoid's anterior, but it's not really anterior surface. So they say which feature, so I'll give you the sample question. Which feature lies or is located on the anterior or costal surface of the scapula? Which feature? is on the costal or anterior surface of the scapula. A, supraspinous fossa. B, infraspinous fossa. C, subscapular fossa. D, spine of scapula.
A, subscapular.
Yeah, I think it was C, but it's, as long as you know, subscapula is always the answer. If they say what's on the anterior surface, it looks like supraspinous on paper, so be careful, but the answer is always subscapular fossa. The answer is always subscapular fossa. Okay, and that's everything you need to know for scapula. Yeah, that's everything you need to know for scapula. It forms two joints overall, the acromioclavicular, which is gliding, and the shoulder joint, sometimes called glenohumeral. Everyone knows that, right? Shoulder joint, glenohumeral, total synonyms. Okay, so then humerus, there's tons of features, except for the three fosses, which I'll do last. Everything is either articular or muscle attachment. Next are neither, but they're not going to be asked. So I'll do the articular features first. Head of humerus articulates with glenoid fossa to form shoulder joint, glenohumeral joint, bone socket. So the heads are always articular, basically. So the head with the glenoid fossa to form glenohumeral shoulder. Then, they're not going to call these, on the test, they're going to say trochlea. So the trochlea looks like a pulley or spool of thread, and it articulates with the trochlear notch of the ulna. The names match, but it's trochlea of humerus. This is always on the test one way or another. Trochlea of humerus to trochlear notch ulna, that's part of elbow. Technically humeral ulna, but they're not going to, that stuff, it's just know it's elbow. Trochlea of humerus to trochlear notch of ulna, that's elbow hinge. So trochlea of humerus to trochlear notch of ulna. Then the smaller feature looks like a head, but they can't use head twice, so they say capitulum. So capitulum of humerus to head of radius, that's also elbow joint, hinge. Capitulum of humerus to head of radius, they always move together, trochlea to trochlear notch ulna, and capitulum to head of radius. On the radius, they're both elbow joint, it's just a hinge, totally. And that finishes the humerus, except to know if they say, the only other question I've ever seen is which are located on the proximal epiphysis of the humerus, and just know it's lesser tubercle, greater tubercle, intertubercular groove, surgical neck. All of those are, and of course head and anatomical neck. There's 6 features on the proximal epiphysis. 2 of them are necks, 2 of them are tubercles. The tricky one is intertubercular. On our test, they won't say bicipital, actually I've never seen, because that's muscle, even though they're synonyms. Intertubercular groove, same as bicipital groove, it's on proximal epiphysis. And the other question is, which are on the distal epiphysis? Just know the trochlear capitulum, both epicondyles, and whereas condyles, which in effect they're trochlea and capitulum, if they were naming them today, they say medial condyle, lateral condyle, but they're equivalent to condyles. They're always inner joint, never muscle attachment. Throughout the whole skeleton, condyles are always articular, never muscle attachment. And often, but not always, associated with condyles, you have epicondyles. They're always away. Epi means away from, like epiphysis is away from the center, and this is diaphysis. But anyway, the epicondyles are always muscle attachment, never articular. So if there's an epicondyle anywhere, it's never articular, always muscle attachment. So these are distal epiphysis, so the 2 condyles, the 2 epicondyles, and the 3 fosses. In case they say which of these are located on distal epiphysis, and they have A, lateral epicondyle, B, coronoid fossa, C, radial fossa, D, all of the above. They're all distal. So the 3 fosses of the humerus are for movement, and they're all distal epiphysis at the elbow, coronoid fossa, radial fossa, and olecranon, the big one, is for the olecranon process, so it's called olecranon or olecranon fossa. All distal epiphysis. Okay, and that finishes humerus. Now, for ulna, there's also, there seems to be three, until we get to lower extremity, there are three articular features. It's not written in stone, but there's always three articular features on long bones, major long bones of an extremity. It doesn't count for the clavicle, but the major long bones in the extremity, which are humerus, ulna, radius, it's three. And just know the names. They're not gonna ask how many, they're just gonna ask the names. And, okay, so the first is the trochlear notch. That's on the ulna. I'll do ulna first. So the trochlear notch articulates with the trochlea, and I've seen that on many tests. They say the trochlear notch articulates with which bone, and it's always ulna, it's always the trochlea of the ulna. And so, I made a mistake there. The trochlear notch always articulates with the trochlea of the humerus. It is easy to make a reading mistake, but usually the question and multiple choice will take care of it. So basically, the trochlear notch of the ulna, or semilunar notch, it looks like a half moon shape, but they're only going to use trochlear notch on the test. The trochlear notch of the ulna articulates with trochlea of humerus, that's part of the elbow. So that's one articular feature, trochlear notch. And the second is radial notch of ulna. That's for the head of the radius to spin in, and that forms the proximal radial ulnar joint. That's a famous pivot joint. There's only three pivot joints by name in the body. Atlantoaxial, I'll get there in about half an hour or something like that. And then the two radial ulnar joints, proximal and distal, which I'll do right now. So the proximal radial ulnar joint is between the head of the radius and the radial notch of the ulna. So the feature on the ulna is radial notch of ulna, articulates with head of radius. That's the proximal radial ulnar joint, and that's pivot. That's pivot synovial. And then the tricky one, but if you keep the idea that all heads of bones in extremities, this might not, it applies to the ribs also that have heads. All heads are articular, because they're the end of the bone, and where bones have an epiphysis or end, almost always articular. The only exception, as not on the test, the heads of the distal phalanges, or the distal epiphysis, those are heads, they're flattened heads. They're not articular because they're at the end of the finger, but that's not on the test, so don't worry about that one. But outside of those, that applies to fingers and toes, but all heads that are going to be on the test of any bone, and it's usually going to be long bones, is articular. All heads of long bones are articular, and so the head of the ulna doesn't move, but the ulnar notch of the radius pivots around it. So the head of the ulna is part of the distal radial ulnar joint. The head of the ulna is part of the distal radial ulnar joint, and that's pivot, like the proximal. Proximal and distal radial ulnar joints are both pivot, so that's the head of the ulna. That's also an articular feature, so you have trochlear notch of the ulnar elbow, radial notch of ulna, proximal radial ulnar, and then head of ulna helps form the distal radial ulnar joint, which those are both pivots. The two radial ulnar joints are pivot, and other features of the ulna, everything else on the ulna is muscle attachment. So the olecranon process is not articular, even though it looks like it could be. It doesn't have flat or smooth surfaces. It just moves into the olecranon fossa, not considered articular feature. This is the articular part on the trochlear notch. But so basically, the other names are olecranon process, and I could say which of the following features of the ulna are located on the proximal epiphysis. A, olecranon process. B, ulnar tuberosity. C, coronoid process. D, all of them. Which would be on the proximal epiphysis of those? Olecranon process, ulnar tuberosity, this is the ulnar tuberosity, and the coronoid process, those are deep, is this crown-shaped feature. So it's all of them. Olecranon, ulnar tuberosity, and coronoid process are all proximal epiphysis. None of them are articular. And so here's my next question. Which of these